Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Hi, I'm Dr. Todd Shatkin, and we're about to place 4 3013 mono implants. This is the mono kit, and we're going to be replacing number 8 and 9 and number 12 and 13 with mono implants. And here's the x-ray of the areas that we're going to be replacing the implants. 8, 9, 12, and 13. And I chose to use the 3013 implants. And of course, this is our cone beam CT. And you can see I chose the 30 because the bone gets kind of narrow there at that indentation. So we're going to angle those implants in that direction and keep it between the buccal and lingual plate. And that's 8 and 9, here's 12 and 13. This was a more recent extraction, but I believe we have enough healed bone to place the implants today. Okay, so I'm Dr. Todd Shatkin. We're going to be replacing teeth number 8, 9, and 12 and 13, as I mentioned. And we're going to use our 1.5 millimeter pilot drill. And we have to make sure that we keep the implants between the buccal and lingual plate of bone. Okay, there's our first pilot hole. Okay, so we made our pilot hole, and now we're going to take the implant out of the sleeve with this carrier. And we're going to go right to the patient's mouth. And one thing I want to show you is, I want you to see the aggressive thread design on the mono implants. The Shatkin F.I.R.S.T mono implant is a very aggressive thread, and it engages the bone very, very nicely, as you'll see. So we screw the implant in until we get good resistance, and I'm getting very nice resistance. So now I'm going to take the carrier off, and I'm going to pull the carrier off of the implant. Now this is a disposable carrier that comes with every implant, okay? And we're going to go ahead with our contra angle driver. Through the implant, and now you hear the beeping. We've reached 30 Newton centimeters of torque, and the implant motor actually stopped at 30. So we're going to go up to 60 Newton centimeters of torque now. Show that on the motor that it's at 60 Newton centimeters now. Okay, and we're going to go ahead and place the implant the rest of the way, and it's beeping at 60 as well. So that's very, very good bone. Okay, so I'm going to take the ratchet driver. And now we're going to use this instrument, which is our ratchet driver long for the mono. This is it looks very similar to the disposable carrier that comes with the implant. Don't get confused and throw away the wrong one. This is disposable, it comes with each implant. This one stays in your kit. This has 1 ring, the disposable one has 2. So now we're going to go ahead and place this implant just a tiny bit more, and now bite together. Okay, and it's just a tiny bit facial, so I'm going to do a tiny amount of bending to the palatal. So I just put the driver on, hold my finger here, and just a very small amount of bend. Okay, bite together. Okay, now we're going to place the other implant. So again, we're going to use the 1.5 millimeter pilot drill. And whenever you see bone on the pilot drill, that's a good sign. Okay, so now we're going to go ahead and take our next implant out of the sleeve. And we're going to go right into the patient's pilot hole where we made. Okay. And then take that carrier away, and again, this is the disposable one with the 2 rings. Okay. Now we're going to go ahead and place that implant with the motor to measure the torque. And we're getting 30 Newton centimeters of torque, and it already stopped the motor at that point. So now we're going to go up to the 60 and place it the rest of the way. And we almost have that all the way in. And just, if you look closely, you'll see that the implant is not quite down all the way to the tissue. The collar, the abutment is still a little bit above the tissue. So I'm going to go ahead and put it down just a little bit further. So maybe 1 or 2 more turns. And let's see. And again, we're going to shoot a tiny bit of a bend. And bite together. And we'll do a little adjustment of his lower teeth there. Bite together. All the way. Bite. Okay. Because he's got a very tight bite. So we'll just do a little bit of adjustment of the lower teeth, and we'll even them up a little. Bite together. Open, just to make a little bit of room for the occlusion. Close a little. Close. Close all the way. Okay, we got enough on number 9. But then we're going to do a little bit on number 8. And close again. And that gives us just enough space for porcelain. And maybe just a tiny bit more on this too. Okay, so those 2 implants are ready to go. And now we're going to do the other 2 on number 12 and 13. I really love these mono implants. I've been using them now for about 3 or 4 years, and we've had excellent success rates with them. I like them better than the 3.0 O-ball implants for these particular procedures. Okay, so we're going to go ahead and make our 2 pilot holes, and we're going to go ahead and place the next 2 implants. And these are 3.0 by 13 implants. Section, please. You can open the next implant, please.
It's open.
Okay. And again, we have 30 Newton centimeters of torque. And close gently. close together. Okay, there's enough clearance there. We'll do the next one. And here's the other one. This is where the more recent extraction was, so the bone's not quite as dense in that spot. But I think we're going to be just fine. We're going to go ahead and... We still got 30 Newton centimeters of torque. Turn toward me just a little bit. Okay. So we're going to just do a little bit of adjustment here on the angle. And then again on this one. Okay. Right together. We're good. Perfect. Okay, let's take our impressions. So now you've seen me place 4 3/0 13 millimeter mono implants in number 8, 9, 12, and 13 in a matter of minutes. And we're going to take our final impressions and make some temporaries. Thank you very much, and we'll see you next time on the Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. I'm Fitz, and we're so glad you could join us this morning. We'd like to spend a little bit of time this morning talking about our Genoray Papaya 3D machine. The machine that we're looking at here has the cephalometric arm on it. Depending on what you're doing at your office, you may or may not need that, but the machine itself is a workhorse, and the 3D sensors that they use are absolutely the best in the business. They're the CMOS sensors, and the image quality, Dr. Shatkin absolutely loves the image quality that he gets from the Genoray machines. And this Genoray Papaya machine right now is priced at a very, very good value. We're selling the machine for $54,995. And we're going into the fourth quarter now, so I wanted to talk a little bit about the $179 tax deduction that you could take advantage of. It's good for all equipment, and this machine certainly falls under that $179. So too does the Action Cube, the Aseptico surgical motor that we sell with all of Dr. Shatkin's settings in it, and any other pieces of equipment that are required for your dental office. Keep in mind to use that $179 tax deduction. It's a really great break on your taxes. So this Genoray, we love the machine. We have quite a few of them out in the marketplace now, and it's a great way after implant placement to take pre and post-op pictures and to understand exactly where the implants have been placed. This morning, I would also like to highlight our 20th anniversary of being in business specials. So Lenny and I and the whole sales team were so excited. We've had so many doctors take advantage of this great opportunity. So we have 3 different packages that are available. We have the silver package, we have the gold package, and we have the platinum package. And with the silver package, you'll save just about $1,700. With the gold package, you'll save a little over $8,000. And with the platinum package, which has a plethora of great items on it, you'll save over $22,000. Keep in mind, anything you need, always call Shatkin first. We have a team behind you, and we're willing to support you. Dr. Shatkin and our entire team are excited to help each and every one of you. I hope you have an excellent week placing mini implants. Call us with any questions. See you next week on the Monday Morning Minute.